Hello, future managers, CEO, healthcare administrators. My name is Mi Nguyen, and my presentation topic for today is primary care training for residents in California. This is the outline of my presentation. So from this presentation, I hope that you could all understand the importance of primary care training on residents, and also what works and what doesn't in choosing an effective training types. According to the textbook, training is the acquisition of knowledge, skills, abilities, and competencies that are required to perform certain jobs. Training is a human resources function, and training methods should match a given situation appropriately to maximize the efficiency for their healthcare organizations and for the learners as well. So the learners, in my case, are medical residents. They're considered as house staff according to our textbook. So they're like an asset of the organization. They have to go through training before they are eligible for medical licensing. In primary care setting, which is the basic level of care, usually referred to as your family doctor, internal medicine, general practice, residents work closely with a team of physician, clinic staff, and patients. Therefore, continuous on-the-job training is super important for medical residents to grow in their area of expertise. It is the fact that California is facing a shortage of primary care clinicians according to a report by Dr. Kaufman this year. The high demand for care providers requires more training for residents to support the healthcare team. So traditional HR practice like individual training has been replaced with team-based training, with a more generic training emphasizing flexibility instead of job-specific training. So in order to explore the resident perception on this team-based care, 182 residents in the primary care residency program at the University of California, San Francisco, were invited to participate in this qualitative study from 2011 to 2012. Residents, they worked in three clinical sites, a veterans clinic, a safety net clinic, and a university-based clinic. The result revealed two major problems with this team-based training was that first, lack of team stability, and second, lack of role clarity. Residents without team stability described frequent team member turnover and complained about having only one resident and one attending in a team. Residents without role clarity describe uncertainty about their responsibility and other scope of practice. So as a result, some residents expressed a tension between their desire to share the workload and a lack of trust that the work would have been completed by other team members. In a safety net clinic, residents reported that they don't have clear understanding of who does what. That's the person who schedules me. I don't know. I don't have a face to that name. I don't know what my responsibility is, what her responsibility is. Sometimes I would rather just do things on my own. So the problem got really serious because it affected negatively the relationship between team members in the safety clinic. So in order to address this problem of team-based training, UCSF University Clinic actually set up team meetings in an effort of putting faces and stories and names together. Residents started to realize how trustworthy other team members are, what they know, what they don't know, and this gradually increased the credibility and build trust among one another in a team. In order to address the instability problem of team-based training, the university clinic again set up more stable teams by meeting once a month within the residents only. This created a positive feedback from the residents. They enjoyed working with their peers, and it made things a lot easier and a lot more fun, some residents recalled. In fact, Kaiser Permanente was well known with its collaborative learning classroom, which is kind of similar to the solution that the university clinic applied. So through this collaborative learning classroom, problem solving is shared among residents, and residents, not the organization, are responsible for their career development. Kaiser Permanente also offers longitudinal training. So instead of focusing exclusively on one care service or specialty each month, the trainees actually see the patients in the clinic, provide inpatient service, treat urgently sick patients, and participate in rotation. Kaiser Permanente also prioritize educational opportunities over heavy patient loads for residents. This means that residents will have time for on-the-job training like shadowing and attending. For those of you who don't know, shadowing means includes observing, attending while on the job. And also they have time for off-the-job training like the collaborative classroom that I just talked about. Residents are allowed to choose their area of concentration as they're going through their residency training program. And this gives residents a chance to focus on their primary medical interests and develop their skills in their profession. So I have talked about primary care training for residents in California with the focus on what elements work for an effective training method. Again, types of training will need to be reevaluated constantly in order to match certain situations. HR employers should actively try to avoid team instability and role conflict among team members by clearly defining roles for each employee and hosting routine team meetings at least once a month. Having elements that point out patient satisfaction as being treated by medical residents is definitely an area that deserves future study. I think that it will not only help the residents to provide better care, but also it helps the patients knowing that they're receiving the highest quality of care possible. So that concludes my presentation, and I also included references for your information, and thank you for listening.